Hi, I am Eduardo Anitua from Vitoria, Spain. Today's topic is how can we treat periimplantitis? It's a very controversial topic, and today I want to present my personal approach after more than 20 years of research into treating cases like this. Is it possible to clean the surface of the implant efficiently? Is it possible to regenerate the bone around the new surface created around the implant? Are these treatments reliable? This is the explantation kit that we developed. It consists of different tips that can adapt to all the different connections that are on the market. And the 200 Newton contractor wrench, this is an extremely important instrument. The method of use is very simple. First, you choose the corresponding implant structure. Secondly, you introduce the structure into the internal threads of the implant and turn the wrench anti-clockwise. In this video, you can see the complete process. In this particular case, it is an external connection implant, and we use structure number 1. We can see in the video how we insert the structure into the internal thread of the implant. We take the contratorque wrench and start to apply contratorque, ensuring that we insert the structure vertically. Very soon, the implant comes out. This kit allows you to remove the most important connections on the market. In this slide, we can observe some examples. Why is the 200 Newton contratorque wrench important? Because if we don't stop at 200 Newton, we can break the structure, like we observe in these examples, or even the implant. And even worse, we could break the mandible. Let me show you an example. This is a young patient who has periimplantitis in the first implant. Other surgeons carried out different interventions to clean and regenerate the bone around the implant. In this video, we can see all the process. We open the small flap to observe the defect and to adapt the structure. In this particular case, we used structure number 2, and we removed the implant in 30 seconds. After that, we had to clean all the defect thoroughly to remove all the inflamed tissue. Which is the best biomaterial to regenerate this type of defect? In our experience, PureGF Endoret is the answer. We condense the fibrin and suture. We can observe the result after 3 months. Now we have the implant in our hands. Do you think it is possible to clean the surface of this implant in the mouth? This is the answer. If you observe the surface with an electronic microscope, we see that it's completely impossible to clean the surface properly. With the photoelectron spectroscopy, XPS, we can see that the surface of the implant is completely contaminated. What with? Probably with particles from the instrument that was used to clean it. After 3 months, we have completely regenerated the bone, just with pure GF endoret, and we can place the implant. In this image, we can see that we have completely regenerated the bone. Here we can see the follow-up of the case after 4 years. This is another case with severe peri-implantitis in the mandible. Is it possible and reliable to obtain 8 millimeters of vertical growth around a contaminated surface with this inflamed soft tissue? Observe our result 5 years after the treatment. Our approach is possible and reliable for all dental surgeons around the world. Let's look at this clinical case. 4 years after treatment, the patient had severe peri-implantitis. This was our approach to treat the problem. We removed all the implants that was contaminated, placed new implants with immediate loading, and regenerated the bone defects with pure GF endoret. In this graph, we can see a study with 107 implants that I removed. 92% of the implants were removed with less than 200 newtons. Only the 8% of the implants needed one additional step. In other words, is it possible to remove the 92% of the implant using this protocol? What is our proposal for these 8% of the cases? Let me show you this clinical case. This is a patient who has had a breach in the mandible for 15 years and today suffers from severe bone loss with an active infection. What is our protocol to treat these cases? My idea was to replace the infected implant with a new implant. This is the CBCT scan, and we can see that the implant is fixed into a very dense bone. If we review this article that I published some years ago, we observe that when the implant is osseointegrated, the distribution of the tension is in the first threads of the implant. We developed one specific design of trephined drills to drill just in the first 3 to 5 millimeters, as you can see in this diagram. Let me show you this video that shows you how it works. The first step is to fix the structure and try to remove the implant with the standard protocol. If we observe that the wrench reaches 200 newtons, we must remove the structure. take the trifine drill and drill 3 or 4 millimeters around the implant. Now we place the extractor again and we can remove the implant easily, probably at less than 115 Newton. We reduce the contra torque drastically. Let's see the clinical case. We reproduce exactly the protocol that I mentioned. We observe how I removed the implant. When the rent reaches 200 newtons, we must remove the extractor. Take the trifine drill and drill 3 or 4 millimeters around the implant. Now we place the extractor again and we can remove the implant easily. And the great thing is that all the bone that I trifine stays in the mouth, as we can observe in these pictures. After 3 months, the defect was completely regenerated using just pure GF endoret, and it's time to place a new implant. In this CBCT scan, we can see that the bone has regenerated completely, and in only 3 months, we have obtained great bone density, and we can place the implant, as we observe in this X-ray. This is my latest book that explains in more detail all our approach to treat mucositis and periimplantitis. Thank you for watching this video, and I am sure that very soon I'll have the pleasure of speaking with you in person at the next meeting in our institute in Spain. Goodbye.